Hi, my name is Sumit. I head the Sunshine by Listen vertical by Listen. So I will just give a brief about actually what is Sunshine by Listen. So basically, the Sunshine by Listen is Listen's single specialty child development platform addressing developmental delays in children. Built in on one of the India's widest, you can say, geographically separate company-owned networks of child development center. Sunshine integrates in-house professional parents and AI, artificial intelligence, into a single care journey. The platform supports 6,000 plus families across 20 plus centers in 10 cities, delivering approx 9,000 plus sessions per month, and has grown, kind of about 4x in the past years, making it one of the largest child development platforms in India. And we are powered by Ray AI, Therapist AI, and Spark, and trained on 7,000 plus hours of real world therapy data monthly. Sunshine expands capacity 5 to 10x of enable scalable and tech-led care. And if you can, if I just summarize it, so we are basically AI-enabled developmental centers, child development centers, dealing with the neurodevelopmental in kids.
So, Marble's Health works on treatment for different brain health issues. Brain health can be classified broadly into two categories: psychiatry and neurology. So, we specifically work on uh, electrically rebalancing networks in the brain to achieve treatment outcomes. So, traditionally, with medication, we balance the chemical activity in the brain. The brain is an electrochemical organ for context, and largely we've only been balancing the chemical activity because medicines are the only ones that have been available and affordable at scale. With Marble's Health, we are now making electrical rebalancing equally safe, affordable, and scalable, so that now we can treat the brain medically in a more holistic fashion. So you can talk about this as a second pillar of medical treatment. So Marble's Health is building a second pillar of medical treatment, introducing it in the ecosystem, and you know, leading better treatment outcomes right from grassroots to tier ones.
Great. Thank you, Ramya, and thank you, Sumit. Okay, let me also talk a little bit about BrainSight. BrainSight was started by me and my co-founder. My co-founder is a PhD from NIMHANS, where she was working on brain connectivity analysis for psychiatric disorders, serious psychiatric disorders. So, schizophrenia, bipolar, uh, like major depression. So, clinically proven major depression. Those were the cases where, as Ramya said, you can use neurostimulation, but also the fact that even much before that, you can use the connectivity patterns in the brain to be able to um, understand variations that are causing the problem, and then you can use that to both understand how to make better drugs, how to better rehabilitate the patient, and to use neurostimulation as one of the treatment therapies. So we have a platform called VoxelBox where hospitals send their advanced MRIs to us, and we do the connectomic analysis on it and send them back the results. Today, we work more with neurosurgeons who are working on brain tumor surgeries, epilepsy surgeries, some doctors who have also used it for schizophrenia and OCD surgeries. So in those cases, our connectomic maps essentially allows them to plan their surgeries better. And in the near future, we hope to get more into neurology and psychiatry, which is where our early interests really lie.
Yeah, that's amazing to hear. Actually, there's a lot of synergy between what Laina does and what we do at Marble's Health. It's amazing to know that you guys are looking into the diagnostic aspect of it, and we can actually come in and address the problem and give them a solution by stimulating their brain. Always rooting for you guys at BrainSight. Amazing work. And neurosurgery is such a tricky aspect to know that doctors have been operating such a delicate region of the body for so long, with no insight into individual variations and differences. They are obviously superhuman, but knowing that you guys are making their lives easier and helping guide these surgeries better is amazing to know.
Thank you so much. Thank you. No, I feel like the three of us together form a spectrum from like
Yeah.
early looking at the brain to knowing what is the problem to be able to actually solving it and then um, being able to kind of because it's a chronic disorder, right? Like it's not
Yeah.
something that with just one treatment you can solve for it. You need constant support, and I think and especially mental health is such a tricky subject. You've got inside the body parameters, which is a lot like how Ramya and I are looking at things, but there's also this whole outside the body parameters, like what are the triggers for you, your developmental pathways. These are some of the things that have to be taken into account, which is so different from other disorders. In fact, I think other disorders and like other medical fields can learn a lot from how mental health kind of combines these two, which actually I think is something that should also be done for other disorders like diabetes and all of these, where you also have depression components, right? Like, and is one of those things that need to be solved for. So yeah, I feel like the three of us form
Yeah.
points of the triangle really at this point of time.
Yeah, that's really beautifully put. In fact, this is something that we've been having a lot of discussions on that nowadays, with more and more research, even thyroid, even any kind of hormonal dysfunction, they're drawing connections to their brain health and their mental health. Uh, yeah, the more and more we're seeing, even some of these cancer cases, there's a growing body of evidence of long-term chronic stress and chronic depression, chronic mental health conditions that have been undiagnosed or suppressed. Also, how they could lead to certain potentially, I will not say that that thing has been completely studied and completely identified that this is one of the core reasons, but that's what's been postulated also. Even for example, dementia, that's also been largely researched. Gabor Mate has done a lot of work on Parkinson's, Alzheimer's, dementia, and how long-term undiagnosed depression, especially in older ages, leads eventually to cognitive dysfunctions, and that eventually could also manifest as dementias and Parkinson's and etc. And in fact, that age at which patients get these diseases is also reducing. Probably
Yes.
because the environment today is not very conducive to a good mental health. I use the word mental health knowing that the brain is both, whenever there's any impact on the brain, it could have a behavioral impact. It could have like a physical change in the brain, which is what you guys are looking into. It could purely be emotional in nature. You don't know. So essentially, that change can also manifest as things in the physical body, right? So we are looking at since the environment has largely and drastically changed around us, with our bodies not being able to cope and our brains not being able to cope fast enough. Uh, that has led to more chronic stress from an earlier age, more sadness, depression from an earlier age, which is then leading to cognitive dysfunctions starting from an earlier age. I'm sure Sumit has a lot to say about the number of children that are coming with
Yeah.
learning disabilities, etc. Also, please, happy to hear that.
Yeah, correct. I completely agree with you. Post COVID, these cases, kind of have kind of affected the overall brain's growth and function, leading to the challenges like Ramya said about the learning disability, ASD, ADHD, and learning disorders, which we are hearing the cases where it's lot increasing post COVID mainly. And I also heard about this marbles that you have introduced one product is, I guess, right? If I'm yeah. So I'm hearing a very good kind of reviews from the psychiatrist mainly, because some of them are kind of using these tools in treating the autism. Yet I don't know what are the outcomes, how the it is affecting the overall treatment. But yes, I'm receiving the very good reviews about it. Yeah, and yet, and I think there are a lot of things that currently, post COVID has also enhanced in this treatment, like the use of AIs in this treatment are continuously coming in. So to get that, you can say the direction, how can we kind of manage these ASTs and ADHDs.
So we actually work with people above 18 years of age and haven't, even though we have some studies going on with Tata Memorial on younger children, our
Hmm.
work has mostly been above 18. I would assume that the challenges of working with children are far much more. And
Yeah.
I would love to know how you both kind of work through that because I think the challenges and the impact, both of it, is actually much more than maybe adults.
Correct. In child, we also have to kind of counsel parents, give them hope that how the treatment will take, because in reality the autism, ADHD, these neurodevelopmental issues can be managed well if the early intervention is done at a right time, right? That's why we call it an early intervention. But to make parents aware, make schools aware about it, is where we are putting a lot of efforts. People should know how, what are the symptoms, how the people should see children's, like if children is not doing the eye contact, if the speech is the delayed, if they are hyperactive. These are some signs where the initial assessment should be done. So yeah, we are doing that awareness among the various doctors, schools, and related organizations, so that they know the early intervention is the key in this complete process.
And do you see a lot of difference between children where people are educated, where their caregivers are educated about these issues versus where they're not educated about these issues? Do you see remarkable change between the two?
Yes, definitely. Because honestly, if I tell you, the educated ones will understand that these treatments usually take a lot of time. Correct? The proper intervention, the proper therapy that is required with the proper frequency and everything. The educated, the parents who are aware about this have done the I will not say study, but have done their work in regards to it, to understand. They are not frequently changing the therapy centers. They are giving time to the child. They are regular to the sessions. These are the differences between the, I will not say educated or uneducated. It's basically aware parent and unaware parent. The
Got it.
parent who
Got
is aware will understand how the therapy will go. He will ask you more questions. He will definitely ask you how, what is the next goal, next treatment plan, what are the session notes, what you are doing in the sessions. We'll do a frequent Q&A with the therapist to understand what are the things that they need to do at the home. Unaware parent is mostly into ki how, when this will end. But yes, the psychoeducation part is most important in it, which we are doing at our centers. For every after every 45-minute session, we have kept 15 minutes for the psychoeducation of the parents, in which we are encouraging parents to ask questions to our therapist, our team, in order to kind of align themselves with the treatment. And in case our therapist has to give some ask some support that they needs to be done at home, in that 15 minutes after every session, we are doing that.
it.
This is
Okay.
how, again and again, telling them again and again, resolving their queries will help them to be aware about the treatment.
And Ramya, given technology and like figuring it out for children must be so much more harder than figuring it out for adults, how are you managing all of that?
That's a beautiful question. Obviously, I think the concern is that the brain is a developing organ when you're a child, and therapy is behavioral, and obviously, the learning ability of a child is highest than an adult. So, whatever you teach them from behavior or from changing their networks is going to stay with them, right? And I think that's the only concern here when we are talking about a child, because essentially therapy in itself is extremely safe, right? But it doesn't have side effects as such. Second, the ease therapy that we just talked about, TDCS, has also been shown to be very safe in children. So the side effects are not there immediate as such. But now, when you're stimulating the child, what are you're actually trying to introduce healthier patterns in the child's brain, right? As that would be in a normal child's case. Now, with therapy, you're doing that behaviorally. With stimulation, you're doing that from an external perspective. So that's something that has been extensively researched um, around the world. And in India, that's what we are doing right now. And some doctors have seen such good results that they're taking that into their clinical practice also. Essentially, what we've heard from our partner doctors also, because we generally, as the device, we give it to the doctors, and the doctors are the ones who decide who to use it on and how to use it on. But what we've heard from doctors is that, you know, patient like parents generally are the people who do the treatment for their kids, right? Who take that treatment decision. They don't want to put the child on medication because
Yes.
medication has to be taken for years together, and there's also a risk that if you stop medication, then those symptoms will come back. It's not a cure as such. It's something that you're changing every day, right? So from that perspective, stimulation happens only for 20 sessions, 30 sessions, and post that you don't have to be on any kind of treatment. You can then continue with therapy, continue with, you know, your other management techniques without having a regular medical intervention. So you can talk about this as a one-time treatment, and in case there's any acute relapse, they can come back with that. We don't see often the results have been holding. For example, there's a doctor in Delhi where he's done this study over a period of 3 to 4 months, and the results have held strong on a 20-day therapy, right? Unlike being on medication for years together as kids. So that is where we're seeing a lot of doctors take up this treatment, and parents opt for such a treatment because they don't like to see their child on drugs, you know,
Yes.
for so long. So that's where we believe it's a much more safer and much more better option for both children and parents also.
Makes so much sense. I think I myself would not like to be medicated for long term or anybody in my family. So I can see where the value lies. I was wondering about how when children do it, like just from our experience, technology adoption is a very
Hmm.
is a hard cycle, right? Like you have to get people to use it, figure out how it works, all of those, and understanding the brain is hard in general. And so you have to kind of really kind of brain and plus technology, and especially a technology like AI is just like way beyond people's understanding often. So I was wondering, for us, it's difficult to explain to people, and it takes us time, it takes us effort. When you do it with children, I'm assuming that would be even harder. I guess that's my. I don't know how it is.
Correct. I do agree with. So in technology, first you have to convince the parents actually why we are using it, how it will help them. First, we have to be very clear to the parents how the technology will enhance the treatment, what it will, what are the things that they will be benefited from it. Moreover, their questions are moreover on the data side. Will you be sharing data with anybody or no? Then we have to kind of make them understand that we don't share any data. It is purely for our internal and everything. And but yes, once that AI, because in technology, first we have to standardize the data, right? Once you have that standardization, that the AI layer will come up, and that AI layer will give you definitely, one is from a customer experience end, all the assessments, all the diagnosis will be much faster as a manual intervention. Second, it will be more onto a therapeutic intervention, how the therapies will move, what will be the goal treatment, what will be the progress, how will the progress will be done. That will be kind of, if AI we will put in a place, that will help to do a treatment in a more structured way and in a proper way, I will say. So yeah, and it is same like I said earlier, na, it is same like a aware and unaware parent that we discussed. So similarly, it is a technology adoption to the aware and unaware. So
Very
yeah,
true.
in
I
some cases you have to tell them how AI is changing the world. In some cases, people are kind of already adopted to it, and this said ki yes, how the things will be benefited for me. My child will be in kind of will get manage more fast as compared to other things, and they can also contribute in their journey. So this is how, yeah, this is again the same aware and unaware
Yeah,
population,
absolutely. Absolutely.
because both the population want to do the treatment. It's not they don't want to do the treatment, but it is just ki how well we can explain them in their words, how it will be benefited to them.
So I think I'm curious to understand where do you see the acceptance for different brain-related diagnostic solutions today compared to 5 years ago, and in the future, 5 years down the line, how do you see the acceptance improving? And personally, for us, one of the first doctors that we had met at AIMS Delhi, like the best institute and research hospital in the country, this doctor is like, I understand you're working in psychiatry, but I want you to know that one of your biggest competitors is not medicine or other companies doing stimulation or anything. It's Babas, yeah, spiritual gurus. So
Yes.
that is something that in India, as a country that is extremely spiritual in nature, and I mean rightfully so, sure, it gives us faith. How do you see um, brain healthcare fitting into this existing narrative, or do you think that that fundamental narrative has to change?
It's a great question. So, in fact, when we started out, and especially because my co-founder's PhD was in psychiatry, and I was like, hey, so I come from a public health background. So I actually used to work with the government of India at various levels on public health issues. And mental health was one of these issues which was never addressed, right? Like public health, it's never one of it's maternal health is probably thought about. You have other things like diabetes, etc., non-communicable diseases. There are entire programs for all of these, but mental health as a system is not really thought about. And so when I met her, we were both very gung ho about the idea that we should build on her credibility and her work to get into psychiatry. But what we realized when we were talking about brain as an organ to look at when you're looking at psychiatric issues, we realized that the adoption curve for something like this was at least 5 6 years away. And that's when we actually pivoted to neurosurgery, given that there were a lot of neurosurgeons who were asking for our work. Now, of course, there is a lot of like intersection between surgery, psychiatry, neurology, and there's like if you look at it, if you put all of these things together is when you actually give holistic care to the patient. But there's still like a divide between the surgery world and the psychiatry world, right? And they're considered very different. And so 5 years ago, we had that challenge of like nobody wanting to adopt for psychiatry. That I think has changed now, partly because I think we worked really hard on it to get that adoption curve going. But I also think that the narrative has changed so much over the past few years that there is more interest in thinking about brain health, more interest in things like longevity and things like that, which have created this buzz around wanting to know more about the brain and wanting to think about mental health. And I feel like now there is more talk about this. And I feel like that talk is only increasing over the next 5 years. And you see that buzz across the world, not just in India, in fact.
And I think now mental health is also not only limited to, like earlier, anxiety and depression. Now the, like Ramya told, like the cancer cases, now the cancer has increased so much. Related to people are, kind of curing it. During the treatment they require that therapeutic intervention, or in some cases the medication in IVF. So there are many line of treatments where the mental health is now becoming a very important part, and doctors itself are now talking about it. Whenever, let's say, cancer, I have seen in some hospitals in Delhi, they have mandatory put the counseling session for the cancer patients. As soon as cancer patient has enrolled for radiation therapy, post surgery, not pre surgery, pro surgery, if they post surgery, if they go for a radiation therapy, for radiation therapy they have mandatory put the counseling sessions for the caregivers as well as for the patients. I have seen for the brain stroke patients, right, where
Absolutely.
the counseling therapy is, kind of mandatory part. And now the insurance is also supporting. Few insurance has started supporting the mental health. So yeah, I agree with Liana that mental health is now not only limited to that depression and anxiety. Now it is becoming the important part of life. And even in some companies too, I have heard that they are also given the mental health leave kind of thing, where 1 week break or a financial and break people are taking. Yes, so that's a good part. When we started Listen approx 4 5 years back, so then we were putting a lot of effort in making mental health understand to the end user. Now what change I have seen in these 4 years itself, the people are themselves talking about the mental health. People are themselves reaching out to us that okay, this is the cancer patient, they require the counseling session. These are the IVF patients, these are the neuro patients, like brain stroke patients, where this counseling sessions or occupational therapy kind of is required. So yeah, that change I have seen in last 4 to 5 years, and drastic change, to be honest. Even some societies are organizing mental health camps.
Oh,
Just
that's pretty
look at
good.
the mental health day. Na? At mental health day, how many people were participating earlier? I'm just talking about these 4 years start only. How many people
Yeah.
are participating then and now? To matlab, across the globe now, the mental health word is kind of doing people. Yeah. So
And
that
how
change
about you,
has.
Ramya? Yeah.
Mhm.
Sorry. Yeah. Have you seen that change in the last 4 years?
Yeah. So essentially, the change. In fact, you were mentioning that with doctors, you had a tough time with psychiatrists, where you were trying to bring in a diagnostic element to it, brain network element to it, and somehow you saw a larger adoption with surgery than psychiatry. Honestly, I think you'll be happy to know, and everybody will be happy to know that psychiatry is slowly looking at the brain as not just a chemical organ, but like an electrochemical organ. Finally, I think largely this year, ANSIPS, Jan 28th to 31st, out of the 290 sessions at ANSIPS this year, 10% of them were on neuromodulation, or stimulating the brain to achieve treatment outcomes. And last year that was probably 2 or 3. Right? So we are gradually seeing that uptake of, once people start looking at stimulation as an option and a solution, that's when they will start looking at the brain as an electrical organ. And that's where the diagnostic aspect will also start coming in. One side you can push from a diagnostic side, and another we can push from a treatment side, to start this to make people more curious about how the brain is working fundamentally, and what else can we do. What we've been doing historically is not cutting it, we realize that. So what else can we do? So I'm really proud to see the breadth of deep tech work and therapy work. And Listen has also been very persistent in making sure and not giving up on that therapy option. I think, like, I think you're one of the success stories coming out of India when it comes to therapy startups,
Yes.
and being able to provide that kind of a therapeutic support. In fact, I think 4 years ago, 3 years ago, we wanted to do something in cancer, because more and more reports were coming out and research was coming out on how the chronic stress element of cancer treatment also, not just pre-cancer identification, even during treatment, that has an impact on your outcomes. So we were really trying to push that kind of an understanding. And what we saw was amazing, in the sense that 3 years ago, doctors were very interested. They were like, "Mujhe ye chahiye, mujhe ye karna hai." But when it comes to the patient is already sort of squeezed dry in terms of these cancer treatments. So getting them to do more, mental health care on top of it, only a very niche percentage of people were able to afford that kind of a treatment for their brain, not just their body, right? The cancer that's there in their body, and the stress, they just accepted it as a part and parcel of it, even though it could have an adverse impact on their treatment outcomes, because they did not want to, give that more money from a financial perspective. But now I'm seeing more and more people, as Sumit also mentioned, that they are voluntarily reaching out, saying that, my wife or my parent is going through a treatment journey. They're very stressed about it, and we can't take medications, they don't want to talk about it. Is there an alternative? So that's the kind of input. Again, I think if you go after like 3 years ago, that was what we have seen. Here we're getting a lot more inbound queries, and happy to see that. Most importantly, we work with doctors directly. So even in doctors, we have a lot more uptake of devices and stimulation, because at to the doctor, patients are coming and saying, "Ki, I don't want to take medication. I've seen a lot of online reviews, ki XYZ. I would prefer a non-invasive option. I will prefer a safer option." So, especially in cities like Bangalore and cities like Delhi, we've been seeing a more uptake in such kind of queries from doctors. And doctors have also been reaching out saying that I would like to avail something like this for my clinic. So, yeah, yeah, and a lot more awareness in just the general population.
Therapists are also kind of supporting that therapeutic interventions apart from medication. They are also kind of agreeing now the along with the medication, the therapeutic intervention is required. So they are encouraging their patients to go for the kind of therapies on not only on the medication.
There's this other very interesting question, which is about how, when you move from tier one, so we work with a lot of we work with top-notch hospitals right now only because they usually have access to an MRI, which is a prerequisite for our work. Um, but as you go to more tier two cities, you go across the spectrum. Um, how do you make sure that their brain health history travels with them, without getting lost in translation? I think it's a really interesting question, given that there are so many. I think for us, we've not had to think about this question, but I'm pretty sure in some time we'll have to, as we kind of move to more tier two cities, as we move to more mid-level hospitals, where the patient profile might be very different from the kind of patients we are seeing right now. But yeah, it's a. Have you thought about that? How you kind of integrate all of this history of the patient, which is about their brain health, the psychiatric health, into their normal day-to-day conversations with their GPs and their doctors?
I think that's more relevant to Ramya, I believe.
Okay, amazing. So, if I could just summarize the question, you're asking how does brain care history, be it neurological, psychiatric, transfer between cities if they're moving from one place to
Transfer.
the other?
Yeah, correct, correct.
I think that's a beautiful question, because it's not just with the brain, but with anything. It's very relevant, and I think the government has done a beautiful job with, the healthcare UHIDs. Presently, I believe having that integrated into each of our software ecosystems will be amazing for the patient at the end of the day to access all of this data. Presently, I say that, but presently, I think that kind of adoption of UHIDs is still incoming,
Correct.
right? It's not to that level that we would love it. I mean, I think it's also relevant to, both Sumit and, in fact, Laina, you asked this question. I think you guys are doing such a brilliant job, like, diagnosing MRIs. Is that something that you give directly to the patient, and do you want this information to be with the patient also? And
Um,
honestly, if I ever receive such a complete health information on my UHID, I would be over the moon.
we often get asked by a lot of people who want us to directly do their connectomic profiling. We haven't done that so far, but only because connectomics is a very small part of looking at the brain, right? Like, and I think also it's because it's so niche, you kind of need a doctor to interpret it, and it's very easy to get a connectomic profile and be like, this tells me this, which is not true. But there is work around how connectomic profiling can be used beyond the patients with like brain disorders or serious mental disorders, how it can be used for more normal, though normal is a very difficult word. No, none of us are normal really, like we are in different this thing, but it can be used in different ways. We hope that as the field becomes much more robust, as overall there is more movement towards knowing about all of this, I think that's the point when, because you have to keep so many things in mind, right? Like, how do you keep in mind neuroethics around how do people interpret it? How do you make sure that your results are not being misinterpreted? How is it not being used to disadvantage somebody, which often happens in mental health situations, right? Like often property wars between people, everything. You use mental health conditions as a way to say that this person should not be getting their property, and this was something that a psychiatrist in our team had really kind of made us think about. So how do you make sure that all of these guardrails are kept around what we do before we
Mm.
start working with patients is a question I don't have an answer to today. And so till I don't have an answer, I don't want to do it.
So I think, Laina, we've talked a lot about the psychiatry spectrum, right? What is happening in psychiatry. I would love to understand what's happening in neurology and neurosurgery. Is there
Yeah.
anything that there is a gap there that probably in the next 3 to 4 years, either stimulation or therapy or any other modality in the future could address? Or in general, if there are any gaps that we would like to discuss for the Indian population?
I think there are so many, I mean, unsolved problems, clinical problems in both neurology and neurosurgery as well. And both without the intersection of mental health issues and the intersection of mental health issues. I'll give you especially since you asked about stimulation, there's a lot of like work around how stimulation, and I feel like I might be using the wrong word here, but for Parkinson's patients, using stimulation, both deep brain and otherwise, to help them kind of come back to normalcy, right? Like there's a lot of work around that. There's a lot of work around epilepsy and stimulation. So there's a lot of interesting work that we are seeing across the world being published in these spaces. Getting them into clinical use, I think, is still it's going to take you, Ramya, and all of us here to actually bring that into clinical use, because in research, all of these have shown a lot of
From
potential. But bringing it into clinical practice requires somebody to go through the regulatory approval, somebody to really think through how do people adopt it, how do you kind of integrate with existing workflows in hospitals. These are some of the challenges somebody has to solve before it actually comes there. But I do still see a lot of matlab, connectomic profiling per se, which is what we do. There's this move towards using it for a wide variety of disorders. That's one trend I've seen. Another trend which I have seen, which I think is increasingly which has been a trend for a while, but I think it's kind of coming together now, which is this whole like multi-omics. How do you kind of take connectomics, genomics, maybe the electrical maps, all of these together to kind of personalize treatment for a particular patient. I think with the advent of more computation power, with the advent of people actually having made each of these individual things a clinical reality, now there's a way to kind of think about bringing these together. And I've seen investor interest, and which I always take as a way to gauge the future of kind of bringing this together. So that is the other trend I've seen, which I think bodes well for mental health as well, because when you get all of these two things together, is when you're actually bringing the mental piece and the inside the body and the outside the body parameters together, and being able to personalize it. And I think that is a trend I'm very excited about.
And
like
just what Laina told, now just adding to it, I think one is the treatment part, and another one is the quality. So if any person is on the treatment, the quality of life, let's say if there is any cancer patient who is undergoing the treatment, right? If that is a stage 4 cancer, even doctors say the treatment, if it is effective till the time it is effective, right? In mostly in stage 4. But the quality of life of a person or a patient during the treatment is something where we need to start focusing, because the treatments are there, the treatments will be, kind of more effective in near future. But I have only one thing: how to improve the quality of life of these patients, because that is something I'm yet to get any answer. I have talked a lot of neurologists, neurosurgeons, but I have never got the right answer. I have just, it is what it is. Matlab, you can't say anything on it. Treatments are available, definitely. One level, second level, third level treatments are available. You can go to X hospital, then to Y hospital, you will get the treatment. Even doctors will refer to the Z hospital to get another treatment. But if you ask, okay, the prognosis of this cancer or any disease is this, how to improve the quality of life, that is something that is yet to be answered. The
I think
quality
that's a
is
very,
something.
very, yeah. It's a very,
Mm.
I think it's a very important point, and I think it's a like I think so when we shifted from psychiatry to surgery, um, for us it was almost natural, right? Like we came from a psychiatric space and we were like, okay, maybe everybody cares about this, but they don't. And that
Yeah.
was a little bit of a little bit of a very interesting that this dichotomy between quality of life and medical treatment. It's a very
Yes.
clean divide between the two, and bringing
Yes.
them together is actually quite a hard task.